Hi, I'm Julie Bisbee, the Executive Director of TSET, or the Oklahoma Tobacco Settlement Endowment Trust. I wanted to meet with you in person today, but as we are safely social distancing, coming to you via video. I'd like to introduce this quick TSET overview video, and then I will rejoin you after that.
It was very consistent with the culture of Oklahoma to eat too much and to walk too little and to smoke too much. We traditionally and consistently had a smoking problem.
Oklahoma had historically ranked very low among the 50 states in our incidence of the quality of our health. Where we should be high, we were low. Where we should be low, we were high. One of the reasons, obviously, that Oklahoma's health ranked low in the nation was because our incidence of smoking ranked high in the nation.
The numbers that we used back then, as I recall, there was at least $2 billion a year in lost revenue based on treatment of tobacco-related illnesses and based on lost productivity.
You know, they have destroyed so many lives over the years through their deliberate lies. It's not that they didn't know what was going on. They have known for over 50 years what they've been doing, and they have lied about it.
I believe nicotine is not addictive, yes.
I believe that nicotine is not addictive.
I believe that nicotine is not addictive.
And I too believe that nicotine is not addictive.
I often say that the tobacco industry is the only truly evil legal industry in the United States, and I define evil as somebody who knowingly and willingly harms others for their own enrichment. And that is a perfect description for the tobacco industry.
The tobacco industry had never lost a lawsuit and had never settled a lawsuit in its history. No one had ever collected a dime from the tobacco industry for a loved one who died of cancer or for their own illnesses. And that was the climate in Oklahoma when the litigation started. As the documents that they were uncovering in the discovery process became known, I became more and more convinced that win or lose, this was a righteous lawsuit. The industry referred to our kids as replacement market. In their own documents, they referred to cigarettes as nicotine delivery devices. And the callous nature of their corporate thinking to my way of thinking was damaging my state, and that I would be remiss if I did not take legal action against them.
Every one of the prayers for relief that I asked for in the district court in Oklahoma is answered, and so much more in the context of this proposal. So I will sign it in behalf of the state of Oklahoma with pride and with assurance that we will continue to work and with further assurance that the children of my state and of every state will be safer in the future because of the work of my colleagues, not only in this room, but across the nation.
When the money was assured of coming in, we started getting a lot of bond salesmen from New York. They came at a regular time every week nearly to try and convince us to sell a big bond issue, pay for it with the money that was coming in from the tobacco settlement agreement.
I think the initial lure of securitization was, particularly in states where they were fiscally squeezed, was, hey, look, we can get $600 million right now and fix our budget hole. Oh, and by the way, we're giving up the next 20 years of MSA payments. And nobody looked sort of long term, and now the chickens are coming home to roost. The money's gone, they're losing money on the deal, and there's no way to get that money back.
The Senate and the House leadership came to an agreement to use the opportunity to make a constitutional change by a state question. And so State Question 692 was put on the ballot.
And ultimately, it passed by a 2-to-1 margin. The Save It, Grow It, Spend It on Health slogan, I think, was very popular with the people, as was the fact that this money would be protected from the legislature, that this would be spent for the purposes for which it was intended and would not be diverted to prisons or roads or the other truly urgent needs of the state, but not dealing with health. So it passed, and the apparatus was set up, and the rest is history.
Well, my first impression was that this is the way to go. In other words, to have the public involved in the decision by a constitutional amendment was wise public policy. And I think in terms of how this whole process was constructed, to have a vigorous debate and then find the best idea and move that forward was the reason I think that we can look back with considerable pride as a state that we did it in the right way.
It gave me an opportunity to see the political process at its best. Again, there was no partisanship. We had Republicans, Democrats, Independents, the governor's office, the business community throughout the state, healthcare community throughout the state, and just concerned citizens all coming together to push for the enactment of this constitutional amendment.
There were other states that established trust funds, but they were statutory, which meant the first time the state got into a fiscal crunch, the legislature could rate it and take the money, and that has happened in other states. Other states took the revenue stream and immediately cut taxes. Other states just simply put the money into the general fund and spent it on the various needs of state government. Only Oklahoma, only this state has protected its money in the Constitution and guaranteed it would be spent on what the lawsuit was all about, and that is the health of its citizens. We stand alone in that distinction.
Oklahoma is the model for the rest of the nation because we were the first and the only state that protected our master settlement agreement money, or tobacco settlement money,
by the formation of the TSET, which I think is great wisdom back that many years ago, that we would set aside that money so we would have it for future generations.
What Oklahoma did in the beginning to set up the TSET program as a sustainable model for comprehensive tobacco control was stellar.
TSET has grown a lot since 2000. You may not know our acronym of TSET, but you probably know the programs that we fund. Some of those programs include the Oklahoma Tobacco Helpline, one of the top ranked helplines in the country, has served more than 400,000 Oklahomans over the years. You also might know us for Shape Your Future. It's our public education campaign that highlights the benefits of eating better, moving more, and being tobacco-free. We have a website, shapeyourfutureok.com, that is chocked full of recipes, physical activity ideas, and a lot of resources to help Oklahomans get their recommended amounts of fruits and vegetables and physical activity. In addition to our efforts to improve health there, we also have programs such as the Tobacco Stops With Me campaign, which focuses on proven policy that saves lives. Through our Tobacco Stops With Me campaign, we highlight the harms of tobacco use, the dangers of secondhand smoke, and the unscrupulous business practices of big tobacco as they work to target our young people and get folks hooked on nicotine. In addition, we also fund research. Our board of directors recently approved a 3-year, $11.4 million grant to the Oklahoma Tobacco Research Center. That facility works on the behavioral aspects of addiction and is a vital component of our state's Stevenson Cancer Center, a cancer research center that recently got the National Cancer Institute designation that will allow for additional funding to come to our state in cancer research, but also improve care for Oklahomans who have cancer and allow them to get their cancer treatment here close to home. In addition to research, we fund partnerships at the local level. We have more than 60 grants across the state working with partners from nonprofits, city governments, and schools as well to make the healthy choice the easy choice. And as many of you know, behavior change is hard, and policy is a key component to helping Oklahomans live healthier lives. Through our incentive grant program, we work with cities and schools and school districts to pass policies that promote health. And by doing that, they then become eligible to apply for an incentive grant with us. If they are selected for an incentive grant, those funds go to those local cities and schools where they decide the best use of their funds. It has to be a project that improves health, and some of those things over the years have included sidewalk improvements, partnering to help fund a city's sidewalk master plan, walking trail improvements for schools that are available for all community members to use through a shared use agreement. Schools have also used incentive grant dollars to buy physical activity equipment, curriculum, and even water fountains and AEDs to really help bring those resources to their community. Again, it's those partnerships at the local level that are really helping to make the difference and help Oklahomans live healthier, longer lives. Together with our partnerships at the state, local, and community level, we have made tremendous progress in improving the health of our state. We have seen adult smoking at record low. We've seen youth smoking cut in half. We've avoided $1.24 billion in medical costs because of people who have quit smoking. Those things are paying off and helping to lower our state's smoking rate 10 times faster than other states that have similar laws on the books and similar price for cigarettes. Together, we are doing good work. I also wanted to highlight our work in addressing the state's primary care physician shortage. TSET has partnered with the Physician Manpower Training Commission to help with a loan repayment program for doctors who are willing to work in an underserved or rural area. If they spend up to 4 years in these areas, they can get the maximum loan reimbursement. We know many medical doctors are coming out of med school with loans, and this is helping them be of service in communities, address our shortage of physicians, but also helping them financially. And what we have found over the years is that these doctors, once they are placed, they make a community their home, they stay. They stay past their incentive time, and they become a health champion in their community. They become a voice for patients. They become a voice for improved health. These are all things that, working together, we are beginning to address our state's poor health outcomes. But the fight doesn't end, as we know big tobacco doesn't take a break. They continue to market their products and look for new and innovative ways to ensure that young people, like those that you may one day teach, get hooked on nicotine early. We know that nicotine changes the developing brain and that our brains are developing up until the age of 25. And that's why it's vital that we partner together to educate on the harms and to also push back on efforts by big tobacco to market to our children. TSET needs supporters at every level in this fight. That's why you, as health educators, PE teachers, physical education teachers, you're role models in the communities where you serve, in the schools where you teach, and you are a trusted source of valuable health information. I would encourage you to get to tset.ok.gov and learn more about our programs. I'd also love to hear from you. Please feel free to email me at julieb@tset.ok.gov. And together, let's keep working to improve the health of our state. Thank you so much for giving me this time in your class, and I look forward to the work that we're going to do together. Thank you.